Good evening and welcome to our PA Clinical Network webinar. We're very excited to have you with us this busy July evening, and we'll respect your time knowing how hectic things are this time of year. With me tonight is our PACN management team, who will field any of your harder questions at the end of the presentation. Our team has been directly supporting and dealing with independent doctors through the majority of their careers, and every team member has exceptional experience supporting care delivery. I myself am a general surgeon from Bucks County who was in independent practice for many years before becoming part of a hospital group. From the very start of my career, I realized that the playing field was unfair for doctors, and I vowed to be part of the solution, serving many roles in the Pennsylvania Medical Society, including board chair and speaker, to advocate on doctors' behalf over the years. As an employed physician, I recognized that even well-meaning hospital administrators and bureaucrats did not know what was really important in caring for patients. What we learned as physicians is not evident from an administrator's perspective. I then got my MBA seeking to learn what they knew and their business language, knowing that they will never fully understand our patient care perspective. The PA Clinical Network is unique as the only state medical society sponsored network in ACO. Over time, and with our demonstration of continued success, this will change, but our members get this special, unique advantage. The Pennsylvania Medical Society has invested in this bold venture with the foresight that came over 10 years ago as the shift from volume-based care proceeded to value-based payments. At that time, PAMED recognized that it was important to give our doctors the tools not only to understand the paradigm shift in payments, but also to thrive through that change. Several years later, and some of you may have been part of that meeting, PAMED developed a practice options initiative to start what is now known as the PA Clinical Network. This initiative recognized the value of independent practice and it's important in the preservation of the profession of medicine. The PA Clinical Network and the PACN-ACO are parts of the Pennsylvania Medical Society. They are legally distinct entities, and the PACN-ACO is a subset of the PA Clinical Network. Many of you are joining in today because of the ACO opportunities and the timing that is required for that participation. All of our members of the PA Clinical Network ACO are part of our PACN. However, the reverse is not true. Some members only belong to the PA Clinical Network, taking advantage in value-based purchase options, as well as quality initiatives in commercial, Medicare Advantage, and Medicaid plans. The PA Clinical Network ACO deals exclusively with CMS for regular Medicare or Medicare fee-for-service. Participation in the Medicare fee-for-service does not interfere with our commercial, Medicare Advantage, or Medicaid plans, nor should it interfere with any of quality arrangements you have in those plans yourself before joining the PA Clinical Network. Why now? Why should you consider now value-based care enhancement to your fee-for-service practice? The reimbursement model in which healthcare providers are paid is changing. Over 30% of your reimbursement will be value-based shortly, with an increased percentage in years to come. This is shifted by your fee-for-service payments, which you may have noticed have remained flat or minimally increased over the past several years. Value-based care is a function of covered lives, and the more covered lives we share together as an aggregated group, the better the contracts we can get with our payers. Many of the measures that are offered are off the shelf and are easy to implement in your practice. At present, managed care insurers and hospitals maintain the lion's share of funding through these arrangements. Increasing quality care, you can increase the amount that comes back to us as community providers. At present, it's only a fraction of what the hospitals get, but the potential is rich going forward. As you observed over the last decade, your fee-for-service income has increased only minimally over the years. However, value-based income is increasing more and more. This can make up the deficit between your expenses in running a practice, overall healthcare cost inflation, as well as the flat or stagnant fee-for-service fees. Value-based income can supplement and exceed that, so you can thrive going forward. At the center of the clinical integrated network, we have built meaningful physician leadership, transparent funds flow, data management and sharing support and care management personnel, guidelines and protocols to be legally compliant, contracting with the insurers and government entities, practice improvement methodology, credentialing within our network and for your practices, and a commitment to quality and efficiency. The high cost of a network and an ACO usually lie in the data management sharing, as well as the care management personnel, which is needed, team-based approach with physician leadership. In data management, this should be a seamless integration with your existing EMR. It is cloud-based, it's in your office, and it has unlimited use. Our care management assistance is a seamless extension of your office. These are people working on behalf and at your direction to reach out to patients before, between, and after your visits to assure that the great care plan that you've administered is carried out. This will result in reduced costs and a healthier population. Our network presently has about 100 doctors, 50 non-physician providers, and has a total of over 50 practices, predominantly primary care, but also in specialties. Our PACN contracts include Highmark Whole Care, which used to be Gateway, Aetna, Capital Blue, Geisinger, and Humana, along with UPMC. Some of the partnerships we form are with Guide Health, Evoco for care management and remote patient monitoring, Coda Health for remote patient care, LabCorp for seamless integration of lab data in your office and cost-effective testing, Brilliant Care also for care management, Mindula for behavioral health, Risk Strategies, and Curie for liability insurance, Incept for marketing, and many, many others. Many of you have joined us tonight because of the PA Clinical Network, ACO, and the timeline for participation in the next performance year of 2025. This deadline is rapidly coming upon us on August 1st to indicate your interest in participating. This is not a final decision, but you do need to get your name on the list for CMS to continue to consider you as a participant potentially for 2025 with the PA Clinical Network. The ACO began in 2022. Once again, it consists only of Medicare fee-for-service patients. This does not interfere with any of your existing contracts in commercial, Medicare Advantage, or Medicaid, nor does it interfere with the PA Clinical Network offerings in those same areas. We have over 30 practices in primary care participating and seamless care management assistance at no additional cost for you and your patients. This is physician-led through and through. The oversight board of the PACN ACO is almost exclusively physicians, and the majority of the voting power lies in you, the participating groups. Once again, the key timeline, your intent to join must be declared by August 1st, 2024. This is only, again, for your fee-for-service Medicare patients or regular Medicare. There's nothing to do with your other plans or Medicare Advantage. The final decision will be needed in September, whether to remain in the ACO. We are asking for now a non-binding preliminary intent from you. We'll both do two-way due diligence. You will look into our network, and we'll look into your practice, and CMS will do the same. And later this fall, you can decide about the PA Clinical Network as a separate entity to joining, but the time pressure is not as important for the ACO. There are other membership privileges, as we talked about, in addition to joining our quality care programs. If you choose, there is steep discounts on liability insurance and other payer purchases. The membership is important to recognize that the ACO, again, in this unique relationship, is very different than other ACOs, and it does not beholden to other entities. We are not affiliated with a large hospital system, nor are we affiliated with any major insurer. And additionally, we are not beholden to Wall Street or venture capital in this arrangement. PA Clinical Network is like Switzerland. It's agnostic. Again, the clinical network itself has diverse contracts, both in commercial and the ACO. There is ancillary services that are provided at savings. We have increased communication lines with our payers, and you are benefiting from the learning and maturity that the ACO has gone through since inception. And once again, the ACO is completely different than separate from the clinical network. The more timely decision needs to be for the PA Clinical Network ACO. Again, you can maintain your independence, determine how best to care for your patients as you see best, but still be part of a group. And together we are stronger. Welcome any questions now, and certainly any questions going forward. Most of you have Keith Taylor's contact information already. And let me see some of the questions that have come in here. And again, I may rely on Keith and others to answer if I do not. We talked, again, distinguishing the PA Clinical Network from the PA Clinical Network ACO. So yeah, the PA Clinical Network ACO is a subset of the clinical network. Your participation in the ACO is not required. You can be just a member of the PA Clinical Network, but again, many of you are here for your interest in the ACO. Likewise, being in the ACO does not oblige you to join the PA Clinical Network existing quality plans. We do have robust relationships and opportunities for the payers that we mentioned before. You are welcome to join. If you have a better arrangement, either your own or with another group, you're welcome to keep that. But we do appreciate the honor of being able to potentially earn your business going forward. Again, the timetable is on the PA Clinical Network ACO for today. Keith, was there any other questions regarding that distinction?
No, not regarding the distinction. One clarifying question that came in was, does this impact my currently negotiated fee-for-service schedules, whether that is commercial, Medicare Advantage, or the Medicare fee-for-service? It sounds like from the description that this is in addition to my fee-for-service schedules.
You're absolutely right, and I'm sorry if we did not bring that out. Yes, your existing fee-for-service relationships, both on the commercial side and the Medicare fee-for-service, will continue as is. So this is a value-based opportunity up and beyond or on top of those fee-for-service patients. What we've also noticed, both in the commercial side and the ACO side, is that there are real-time opportunities for increased fee-for-service as you administer things like chronic care or remote patient monitoring. If and when appropriate, you can have opportunities for real-time billing increases. Additionally, as you identify, and we help you identify your more complex patients, those can be brought back more frequently, and again, increased revenue for your practice when appropriate. Another question coming in is about MIPS. So all of you participate in MIPS mainly to avoid the drastic decreases in fee-for-service payments that will come in subsequent years if you do not report quality. As a member of the PACN-ACO, MIPS is taken care of for you. We report as an aggregate group on quality and on your behalf. You do not need to separately report MIPS at that time. And again, we and our staff, using questions back to you in your practice, should be able to complete those quality reports back to CMS. Another question coming in, do I have to change my EMR? No. We interface with almost every EMR. Paper-based practices do present a challenge. And at least for the ACO, if there is no intention of ever switching to a digital EMR, it's probably not the best time to join our ACO. A lot of, again, in aggregating all the groups over thousands of patients and what we anticipate growing to being tens of thousands of patients, it is impractical, improbable, and inefficient to do the intense care work that we need without electronic access. And I say that with sorrow in my heart because I'm not a big EMR fan myself. I do believe that EMRs get between us and our patients. Many of the EMRs that are out there are predominantly billing platforms with the patient stuff kind of tacked on as an afterthought. They're not intuitive workflows for us. We do work with some EMRs, and we do have found some of them are more cooperative than others. And again, if you need those suggestions, we can provide it. If you're happy with your EMR, you can keep that as well. Another question is, well, we already went over it, that we have 32 or 33 practices in the ACO right now before you join us for 2025. We certainly welcome those and expect significant growth in the upcoming years of that. Cost, there is a cost to the PA Clinical Network membership. And again, anybody in the ACO is also a membership part of that. However, those costs are rapidly offset by the savings you get either in quality-based plans and other things. We do not want cost to be a barrier in this. Again, the costs are minimal. The costs are also obligatory. Legally, a clinically integrated network, the participants must have some financial stake in the game. Membership does fulfill that criteria so that we can come together, share information, share data, and improve care. Without that legal satisfaction, there are antitrust and other things that can come into play. So some element of participation and financial stake is needed. We have been fortunate that giving out over, well, I think at the end of this month, it'll be over $4.5 million back to our practices there. And this has more than paid for any dues that need be. So please don't let this be a barrier. If there's any individual arrangements that we need to talk through, we'll do that with you. I don't see any other questions in the queue. Keith and team, is there anything that we've left out?
One coming in my way is, you had mentioned cost savings offsetting the cost of membership. Can you give an example of one or two of where I might be able to expect cost savings? What services you might be referencing?
I think liability insurance is probably the biggest one. We do work with ProAssurant, which is the remnant of PIMSLIC, very similar to our organization today. Many years ago, and this is going back to the 1990s, the Pennsylvania Medical Society owned its own professional medical liability insurance company called PIMSLIC. That was sold to a larger entity called NorCal, which was subsequently sold and merged with ProAssurance. So we do have favorable rates with them. Also, there's a North Carolina-based company called Curie, which we have found to be actually very competitive. And most importantly, Curie maintains many of the philosophical missions that we have, mostly restoring the joy of medicine and the practice. It is a physician-only focused company. They do have other services for consultation as well as for financial management, which many physicians find helpful in addition to liability insurance. So um the right off the bat, that's where a lot of the savings is. A lot of the quality programs do have savings that they'll recognize throughout the course of a performance year as well as at the conclusion of a performance year, and those are add-on benefits that again offset any costs that usually you incur to participate in the network. uh, I hope that answers that, Keith.
Yep, and there's nothing else in my docket.
Great. Again, I don't want to take more time that you have. I know this is a busy time of year. This is recorded, so if you do have colleagues that wish to visit or hear this at a later time, we can arrange for that. Again, August 1st is the key date. This is not a date, this is not a written in stone commitment to join, but rather it is a placeholder that you put your name in. We declare that to CMS, and this way you are able to participate in 2025. If you decide later in August or in early September that this is not a good fit, no harm, no foul, no obligation. You can go on and participate in just the PA Clinical Network, or think about it even longer. But again, August 1st is by CMS requirements, the deadline that we're working with now. We'd love to have you join us. We are growing, we are successful, and with your help, we'll be even more so. Well, with that, good night, everybody. And again, looking forward to hearing from you or your questions. There's my contact information there. Just to let us know. And in the flyers leading up to this webinar, you have Keith Taylor, our business development senior director. You have his contact information too. Looking forward to talking to you. Have a great night.